A little over a month after the city's Board of Health passed a resolution declaring racism a public health crisis, city health leaders are taking action.
Yeah, there's a coalition of medical experts who will investigate healthcare disparities, what causes them, and the steps that need to be taken to address them. So joining us this morning is the New York City Health Department's chief medical officer who will be overseeing this coalition, Dr. Michelle Morse. So good morning to you, Dr. Morse. Thank you for being here.
Good morning. Thanks so much for having me.
So I want to talk about this important topic, but I first and foremost want to know if you can at least give us an update right now on what you're hearing about the Omicron variant. This is big news that people are waking up to, right? People are talking about it. The big thing is not when, but not if, but when it will arrive in New York City.
That's right. Yeah, thanks so much for asking that question from the jump. I think it's really important for everyone to remember that, of course, scientists across the world are really monitoring this very closely, and our scientists here in New York City are also monitoring very closely. We haven't yet detected a case here in New York City. However, the most important message for all New Yorkers to protect themselves, as always, is to get vaccinated, to get a booster, and to be extremely vigilant about how you're traveling, where you're going, et cetera. So we continue to watch very, very closely, as well as all of the experts across the country and the world. And we are really encouraging all New Yorkers to go ahead and get vaccinated or get boosted.
Get vaccinated, get boosted, and get tested, right? There's also these concerns that it may not be able to come up in a test. Are you hearing anything about that?
Great question. At this point, we're encouraging everyone, if they have symptoms, if they've been exposed, to go ahead and get tested. We are not currently concerned that this particular variant will not be picked up by testing. So please do get tested. And there are sites all across the city that the health department and the city are running that are free for testing and are available and accessible to all New Yorkers.
All right. Thank you so much for updating us on the Omicron variant. But back to our healthcare system. So who is invited to take part in this coalition, and what kind of research will you actually be conducting?
Yeah, thanks for the question. We're really excited, of course, to be working with our healthcare partners all across the city. We invited all of our healthcare partners to join this coalition, and we're really honored and excited that 12 health systems across the city have decided to join. New York City Health and Hospitals has been one of the founding members of the coalition, and it's called the Coalition to End Racism in Clinical Algorithms. And this is a coalition that really has 3 goals over the next 2 years. And the 12 members of the coalition have committed to, number 1, ending race adjustment in clinical algorithms. And I can explain a little bit more about what that is. Number 2, to monitor the racial and ethnic inequities or disparities in the areas that are related to these clinical algorithms. And then thirdly, to have a proactive patient engagement plan to make sure that patients whose care may have been impacted by race adjustment get access to the care they need and deserve.
I guess, what exactly, Dr. Morse, if you can just kind of lay it out in layman's terms, what the algorithm actually is and means for those who may not understand it?
Absolutely. So us doctors, I'm an internal medicine doctor myself. Doctors, nurses, and other providers use tools like clinical algorithms to decide, to help us figure out which patient should get what tests and what treatment. And so the bottom line is that these clinical algorithms are tools that we use to figure out how to care for patients. And the way that the clinical algorithms were created was that researchers and providers look at large databases of information about patients. And what we try to do is figure out what's the pattern. And then we use that pattern to predict going forward which patients might benefit from which tests and which treatments.
Aside from
the challenge is, sorry, go ahead.
You can go ahead. The challenge is what?
Yes, the challenge is that sometimes these algorithms use race in a way that makes it look like patients of color have normal values when in fact their values are not normal. And that comes from a history, unfortunately, of racism in medicine.
So let's take a look at this from a perspective of something that just occurred, right? We kept hearing about communities of color obviously being hardest hit by COVID. Could any of this have played a factor into some higher numbers in certain communities of color? Could those algorithms and race adjustments have played into this?
Well, thank you for the question. And the health department in New York City, of course, we are extremely concerned about the disproportionate impact of COVID on some communities, especially communities of color. However, we do see that it's policy decisions and resource decisions, structural racism, and other social and policy decisions that have made some communities, especially communities of color, more vulnerable to COVID. So we don't see these specific clinical algorithms as one of the drivers of the disproportionate impact of COVID, but we do know that communities of color have been made to be more vulnerable over generations because of disinvestment, structural racism, lack of access to care, being in jobs that put them at higher risk, et cetera. But that is a little bit different than these particular algorithms.
Yeah, well, obviously equity in healthcare is very important. Dr. Morse, thanks so much for joining us this morning.
Fascinating.
To explain that and also for updating us on the Omicron variant.
My pleasure. Thank you so much.